DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm glad you joined me today. I'm Dr. Dan Thomson, and today we're going to talk about something that we see in cattle all the time, and sometimes we don't take the time to explain what's happening. It's called bloat. We're going to discuss bloat, different strategies, why it happens, how to treat it, how to prevent it. Thanks for joining me. More after these messages.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson here from the College of Veterinary Medicine at Kansas State University, where I serve as the Jones Professor of Production Medicine and Epidemiology. And today we're going to talk about something that is a cattle disease or syndrome that is associated with nutrition. And really what we're talking about is bloat. And when we talk about bloat in cattle, there are two types of bloat that we're going to discuss. One is the frothy bloat, and two is free gas. And so they're both kind of self-explanatory when you start to think about it. When I think about frothy bloat, it is cattle that are on legumes or cattle that are on wheat pasture. And what happens is, in that rumen, when we get the intake of these lush forages that are high in proteins, high in tannins, we can get a froth that is built up. And whether it's a foam or a froth from the interaction of the microbes in the rumen with the tannins in these rich legumes or this in rich wheat pasture, we'll get this frothy bloat. And when you tube a calf or if you puncture a calf in the rumen, you'll see the froth just keep coming out. The other type of bloat is called a free gas bloat, and this is due to increased production of gas whenever we have the rumen microbes and this is more common in a feedlot situation or more common in a calf that's on a grain diet. What'll happen is that we'll get a bout of acidosis or decreased pH of that rumen. When that happens, sometimes the animal's contractions in the rumen or the ability of that animal to burp or eructate gas out of the rumen is the sensors or the stretch receptors in that rumen don't work quite right. And so when those don't work, that animal's not able to belch or eructate and give off that gas, so we get a bloated situation. Now, the clinical signs of bloat are pretty straightforward. We're going to look at the animal from behind or look at him from the front. The rumen of the animal is where the bloat occurs, and that's located on the left side of its body. And when we think of left side of a calf's body, it's that. It's not us looking the left side at what we're looking at. It is the left ear, the left leg, the left side is where the rumen's located. When we have a zero, we grade bloats 0, 1, 2, and 3. A 0 is no distension on either side of the calf. A bloat score of 1 is starting to get a slight distension on the left side of the animal where the rumen's located. On the right side is just the intestines, the small intestine, large intestine, colon. When we start to get to a bloat score of 2, we'll have severe distension on the left side of the animal, but the right side will be normal. And then when we have the most severe score of bloat of a 3, we will see distension of both sides of the animal, and we'll call it kind of a papal shape, we'll have it rounded on the left side and kind of a pear shape on the right side. So 0 normal, 3 is severe, and when we get a severe, when we talk to people out on wheat pasture research, when you have a calf that has a bloat score of 3, that animal will be chronically affected and have decreased performance the rest of its life. We're going to talk more about bloat. We'll talk about why it happens, how you can treat these animals, what you can do with them after they've had that syndrome. More to come. Thanks for watching Doc Talk. See you after these messages.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Jonathan Angel wanted to be a veterinarian since boyhood. He grew up near his grandparents' farm, where he spent much of his time. Completed the Boy Scout Veterinary Medicine Merit Badge in high school, and later shadowed the doctors at Sugar Creek Vet Clinic. After graduation, Jonathan will be joining this practice, and he and his wife will also move back to his grandparents' farm to raise polled Herefords.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Calves require adequate, high-quality colostrum immediately following birth to receive the immune and nutritional support needed to fight diseases and thrive. Next-generation Colostrix colostrum replacer and supplement are USDA licensed to aid in the treatment of failure of passive transfer and contain natural maternal bovine colostrum antibodies against E. coli K99. Ask your animal health supplier for Colostrix or visit agrilabs.com for details. Colostrix makes all systems go.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here from Kansas State University's College of Veterinary Medicine, where I serve as the Jones Professor of Production Medicine and Epidemiology, and we're talking about bloat. And so whether we have animals that are on grain diets or animals that we're kicking out on wheat pasture, we're going to run into bloat. And when we start to think about bloat and the cause of bloat, there are the two syndromes, right? We have frothy bloat on wheat pasture if you have them kicked out on alfalfa. And then we'll have the free gas bloat, which is predominantly the type of bloat that we see when we have animals on grain. So when we're looking at our show cattle, or we're looking at cattle that are in feedlots on finish ration, we're talking more about free gas bloat. And when we're talking about the calves kicked out on wheat, we're talking about frothy. Now, the reason why we see this and the risk association with bloat is different for different types of syndromes. So on the frothy bloat, the number one risk factor for frothy bloat on wheat pasture is over-application of fertilizer. In other words, if we over-fertilize or if we put more fertilizer on the wheat pasture than we did the year before, we get more lush growth, and we put the same number of cattle, there's more material out there with the same number of cattle. And so when a storm pattern comes through, cattle are genetically or evolutionarily will go in right before a storm. They see the drop and feel the drop in barometric pressure, and they will consume more before the storm, because then they'll go and they'll hole up or wait until the storm passes and come back out. The ruminant animal can store about 5 to 7 days worth of food supply in the rumen. So in other words, if a calf stops eating today and a storm comes through, it'll take 5 to 7 days before the rumen empties. So they'll go out and they'll consume too much. And I think more times than not, when we see problems with bloat, it has more to do with weather patterns and availability of feedstuff than anything. So when we look at frothy bloats, the first thing we have to do is we have to make sure that we're applying the right amount of fertilizer, make sure we have the right amount of growth. If we're going to add fertilizer, we need to add animals to take care of some of those. You can have some preventatives that we're going to talk about as well. On free gas bloats, this is a sequela or a sequel to something that happened before. In most bloats, prior to bloat occurring in the animal, we will see an increase in grain overload, which will cause acidosis. Acidosis will cause the reduction in the pH in the rumen from them overtraining on the grain. That will decrease or change the rumen microbes, which will then lead to more acid production in the rumen, which knocks out the stretch receptors and doesn't allow that animal to eructate or release the gas. The other thing that can happen with bloat in the feedlot pen, so it's really important that you understand where the animals are located, is what we call overbalance. And the term overbalance could be a mound that's too steep, and we've seen cattle, they'll get their feet uphill and then they can't stand up. So you have to roll them over so that their feet are downhill and they can stand up. If a calf gets its feet uphill and it's laying down, or if it's laying in an indention, the gas bubble will actually move to the ventral side or to the side where the animal then can't belch. And if they can't get up, they'll actually continue to increase gas production in the rumen, not be able to eructate, and so we see some things to that nature. When we come back, we're going to talk about how to treat free gas and frothy bloat. You're watching DocTalk. Thanks for joining us. More after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation out of Great Bend, Kansas. Today's BQA Tip of the Day, we're going to visit about branding these cattle. Branding is a common procedure done throughout the United States and the world, but it's very important that we do the best we can to do that brand efficiently and in a timely manner. These cattle here turned out on right. We often brand these sort of cattle when they're turned out of confinement so that if something happens, they get spooked, they get out, we have a means of identification of those animals for that producer. There's many different producers out there. They all have their different brands. But again, the important thing when we are branding these cattle is to have adequate restraint and to be able to do that brand in a timely manner. We want to make sure our brands are functioning properly, whether it's electric or if they're still being fired by propane or wood. We want to make sure that brand is good and hot so that we use the minimum amount of time to brand those animals. Again, adequate restraint and a properly functioning brand are keys to successfully branding cattle in a good and proper manner for that animal. Thank you.
It takes vision, dedication, hard work. It takes knowing who you can trust. At Zinpro Corporation, we have more industry-endorsed research behind our trace minerals than any other company. Proof that our patented performance minerals help improve overall animal health and performance. Lots of companies make claims. At Zinpro, we generate results.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Beef producers asked for it, and the wait is over. Enroflox 100 Enrofloxacin from Norbrook, now approved for single-dose treatment and control of bovine respiratory disease, with the same active ingredient and dosing regimen as Baytril 100 in beef and non-lactating dairy cattle. Choose Enroflox 100 when looking for an injectable antimicrobial solution to treat and control BRD. Observe label directions and withdrawal times. See product labeling for full product information, including warnings and precautions. Consult your veterinarian to see if Enroflox 100 is right for your cattle.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea
what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
True Test Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, Dr. Dan here from DocTalk. Thanks for joining me today. We're talking about bloat in cattle, and it's something that occurs commonly, and we're going to talk about treatment of bloat now. So if we have cattle out on wheat pasture and you pull in, and here's one that's a bloat score 1. A bloat score 1 is a minor bloat. It's just a puffiness on the left side of the body, and so those animals are probably not going to treat. But once I get to the bloat score 2 with severe distension on the left side, and definitely a bloat score 3, those animals need to be pulled in and we need to treat them. You can be assured that most cattle on wheat pasture are going to be of the frothy bloat variety. Therefore, when we treat them, and the best way to find out if they're frothy bloat or free gas is to pass an orogastric tube. So we'll take an orogastric tube or a stomach tube, and the first thing you want to do is put a speculum in the mouth of the steer. Because if you don't and you pass a rubber tube, those molars on the back side of that cow's mouth or that steer's mouth will chew that tube in half. And that's not a good thing to have happen, because when you pass that tube halfway down, the calf chews the orogastric tube off, you're going to wind up with half the tube in the rumen and the other half in your hand. Not a good situation. So have a metal or plastic speculum that you're going to pass that'll guard that tube from being chewed in two. You're going to pass the tube, and then you'll want to blow on the tube a couple of times to get feed stuff out away from the end of the tube, and you'll know pretty quick then whether you have a frothy bloat or free gas. If you have free gas, you'll actually have gas coming out. You'll see the sides starting to not be as distended. If it's frothy, you'll actually have the froth come up the tube. If it is frothy bloat, leave the orogastric tube in. Have your TheraBloat, which is paloxylene. Paloxylene will come in a 1 ounce treatment vial, and you will take that and mix that with a pint of water, and then you'll pass that 1 ounce of TheraBloat in the pint of water into the rumen. You can add more water if you want. It'll disperse evenly, and what that does is that starts to break that surface tension of the froth and will help that animal decrease the frothy bloat. Sometimes you have to retreat these animals. Sometimes they become chronic frothy bloaters, and those animals need to be railed. If it's a free gas bloat, when you pass the orogastric tube, you will start to get the gas to come out, okay? Now, my rules on treatment of calves with free gas bloat, because we'll see these as repeat customers as well, is that I will treat them. I have the 3 strikes and they're out rule. I will let them down, let the gas down 3 times. On the 3rd time, I'm going to make a decision. Either I'm going to put a fistula in the side of the animal, which is an actual open hole from the rumen outside the side of the animal. We can stitch the rumen wall to the hide of the calf, and he can let free gas go out continuously, and that will take about 6 months to a year to close. Or I'm going to rail that animal or sell it for salvage slaughter. It's the 1 or 2 things, because if they continuously come in, you're going to wind up having that, and the animal's either going to wind up dying or from bloat, or you're going to wind up continuously having to treat them to let them down. When we come back, we're going to talk a little bit about emergency treatment of bloat on your farm with your cattle, which is really important to understand and know. Thanks for watching DocTalk. Thanks for being with us today. More about bloat and emergency treatment when we come back after these messages.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here. We're talking about bloat in cattle. So now you walk out to the pen and you have a steer that's severely distended. This calf is a bloat score 3. It's distended, round on the left side, pear shape on the right side, and it's not functioning appropriately. So we're in an emergency situation when this happens. The first thing that you're going to want to do is remember that the rumen is on the left side of the animal, not the right side of the animal. So if we're going to do an emergency treatment of that animal in the pen, we're going to puncture the animal through the paralumbar fossa, or through the left side, as you can see in this picture, high on the left side at the apex of where that rumen is distended. So when we do this, we want to make sure that we use something that's extremely sharp. If you puncture the animal on the right side of its body, you're not going to hit the rumen, you're not going to hit where the gas is, you're going to actually hit intestines. So make sure on the left side of the body, okay? The first thing you have to understand is do not let the animal lay down. An animal that's severely bloated that lays down and then you go to the house to find a pocket knife or a bloat needle, that animal will die from suffocation before you get back to it. Once they lay down and they're super distended, the animal's not going to make it. So this is an emergency situation. So you can have a bloat needle, and I suggest to a lot of people that own feed yards or that are feeding cattle to have a bloat needle on their person. And the bloat needle is in this picture here, and you can see that there is a trocar and a stylus that goes down through it. This is extremely sharp. And you can puncture that animal on the left side, pull the stylus out, and you have that trocar that's going through, that's allowing the release of the pressure, and that animal will immediately have relief. We have emergency trocars that you can use that will create a fistula in the side of that animal, and these actually, you can see from this picture, you puncture and then you screw, and it'll actually screw that rumen wall and screw the outside hide in that paralumbar fossa together, and will give you a couple of days to take that animal for salvage slaughter. The other thing, the last resort, is if you see the animal and you need to use a pocket knife or something to that nature, you can. Now, two things to understand about this. Number one, there's a reason why they make footballs out of cowhide. It's tough. So you need a sharp knife. And two, you do not want to have a jackknife that has a flexible blade. Make sure you have something that's a lock blade or something that is solid handle to the knife. I have used a pocket knife once to puncture, and that thing came shut on my fingers. Do not use a Bowie knife, okay? There is some anatomy on the left side of that animal, and you will cause some damage. So a short 4 to 6 inch blade, lock blade for your safety if you're going to use that to puncture an animal. Never let an animal with bloat lay down. Emergency situation, have the proper tools in place. You can work with your veterinarian. He'll have those tools, or she will have those tools at her clinic, and then you can utilize them on your farm or ranch. Thanks for watching the show today. Remember, if you want to find us on the web, you can go to www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson here from DocTalk. Thanks for watching us, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.